Biomarker testing helps to provide the unique cancer profile of a patient by looking at certain biomarkers such as genes to understand what is driving the cancer growth. The test can be done either through a liquid biopsy, which is using a simple blood draw, or through a tissue biopsy by taking a sample of the patient's tumor. Identifying these biomarkers can help in making treatment decisions for patients with advanced stage cancer. For example, certain drugs or treatments that may be effective only for certain biomarkers, whereas the presence of some biomarkers may prevent the effectiveness of other treatments. In such instances, doctors may be able to recommend other alternatives for the cancer treatment. In addition, biomarker testing may also help patients enroll in relative clinical trials. Using a liquid biopsy to test for biomarkers is a safe, a reliable, and a non-invasive procedure compared to a tissue biopsy. It involves a simple blood draw from the patient, and it does not require biopsy or repeat biopsy of the solid tumor. This is especially useful when there is not enough tissue available for biopsy, or if the patient is unable to undergo a tissue biopsy for various reasons. Test results from a liquid biopsy can be received within 7 days from when the blood sample arrives at the laboratory, whereas a tissue biopsy can take anywhere from 2 to 4 weeks on an average. This enables patients to start on their treatment faster compared to a tissue biopsy. For patients with advanced stage lung cancer, for example, more patients may be eligible for biomarker testing through a liquid biopsy as compared to a tissue biopsy. And based on these test results, they may be matched to approved therapies faster and more comprehensively. In theory, a liquid biopsy may also deliver more complete information regarding the patient's entire tumor burden, because the sample theoretically represents all the tumor DNA that is present in the circulation, as opposed to the spatial limitations of a biopsy sampling, which is done for a single lesion within a single anatomical site. Another benefit of liquid biopsy is that it can be used to monitor response to treatment by quantitative measurement of tumor DNA over time, and this is becoming more and more prominent in the recent literature. Liquid biopsies that provide comprehensive genomic profiling give a more detailed profile of a patient's tumor compared to tests that only check for specific biomarkers. As cancer is a genetic disease that evolves quickly, having as much information as possible about the current profile of the tumor can help give personalized treatment for each patient. Recently, the International Association for the Study of Lung Cancer has recommended the adoption of liquid biopsy for patients with advanced stage non-small cell lung cancer, and that such testing be performed by a clinically validated, comprehensive liquid biopsy rather than those tests that only look for certain biomarkers. I met a wonderful 73-year-old lady who presented with an enlarged neck lymph node, a big lung mass, bone, as well as brain metastases in September of 2018. Her initial biopsy was done at an outside institution, and we were unable to retrieve tissue to do molecular genotyping of her cancer, which is mandatory today. Fortunately, we were able to do a liquid biopsy, and this confirmed the presence of an activating mutation in the exon 21 EGFR gene. A first-generation tyrosine kinase inhibitor was started after she completed whole brain radiotherapy. She did very well, but about a year after her initial treatment, her diseases started progressing, this time in her bones as well as the abdominal lymph nodes. Now, since the biopsy was technically difficult and invasive, we decided to repeat her liquid biopsy. This confirmed the presence of the original activating mutation in exon 21, as well as a new T790M resistance mutation. And based on this information, I was able to switch the patient to osimertinib instead of standard chemotherapy, which would have been the default. She benefited from this treatment for another year and a half. Then, unfortunately, the disease progressed and we repeated the liquid biopsy. At this time, it did not show any actionable mutation, so I switched her to chemotherapy and she continues to do well. So this is a good case that highlights the benefit of a liquid biopsy in not only establishing the original genotype of a lung cancer, but also explaining the mechanism of resistance at progression, based on which I could choose the right treatment for the right patient, which is the foundation of personalized or precision medicine.